Hello, everybody, and thank you for joining us today. My name is Dave Hornell. I'm the editor for Diagnostic and Interventional Cardiology magazine. On behalf of DEIC and our sponsor, GE Healthcare, we would like to welcome everybody to today's presentation. It is titled Intelligently Efficient Adult Echo Structured Reporting. The dynamics of our world are changing rapidly. Cardiologists are being challenged to complete documentation in an increasingly challenging clinical setting, and this is while adhering to ever-changing guidelines, both of which require taking workflow efficiency to a higher level, something that is not easy even in the pre-COVID-19 world. The fact is, 43% of cardiologists are burnout and spend twice as much time interacting with the electronic medical record than they do with patients. Today, our panel of experts will share their experience with structured reporting, how this positively impacted their workflow, and perspectives on AI in cardiology and the path forward. Our featured speakers today are Dr. Diego Segura Rodriguez and Dr. Anatoly Trachtenbreit. Dr. Segura Rodriguez is a cardiologist specializing in cardiac multimodality imaging, working at CECILIO University Hospital in Granada, Spain, where he combines cardiac imaging with clinical cardiology. During his career, Diego has developed skills in echocardiography, including transesophageal and stress echocardiography, reaching advanced certification by the Cardiac Imaging Association by the Spanish Society of Cardiology. He thinks that multimodality imaging is an essential role in cardiology, and he also has expertise in both MRI and cardiac CT. Dr. Trachtenbreit graduated from Albert Einstein College of Medicine in 1984. He completed his internal medicine residency and served as chief resident at the University of Texas Health Science Center in San Antonio. He also completed his cardiology fellowship at Baylor College of Medicine in Houston. He has been with Cardiology Clinic of San Antonio for 29 years and retired this year. He was a director of non-invasive cardiology at Methodist Hospital in San Antonio, was involved with the implementation of structured reporting, and used the GE CVIT system for 3 years. Today's presentation will be moderated by Christine Demore. She is a GM for Cardiology IT at GE Healthcare. We'll also have a demo provided by Jessica Brenzel, the solution consultant for Cardiology IT at GE Healthcare. We're going to get started in just a couple of minutes, but first, a little housekeeping. You'll notice on your viewer that we have the ability to ask questions, and we encourage you to do so, and we will try to answer as many questions as we can at the end of the presentation based on time availability. Any questions that we do not get to will be answered offline. And with that, I'd like to turn things over to Christina Demore to begin the presentation.
Thank you, David, for the introduction. Imagine the complex care pathways that exist for cardiology patients today. Patients presenting in the ER with chest pain, with coronary artery disease, congestive heart failure, AFib. These patients require a very demanding care pathway. The cardiology ecosystem is complex, consisting of different devices, different workflows, and different data sources. Typically, cardiovascular departments rely on a complex mix of devices, systems, and tools to care for their patients. As we drive towards bringing this complex ecosystem together to better serve the cardiology care pathways, a comprehensive cardiovascular IT solution becomes increasingly important. Cardiovascular IT brings the cardiovascular service lines together into a single enterprise solution. An integrated cardiovascular PACS and information system, such as Centricity Cardio Workflow, Centricity Cardio Enterprise, bridges the gaps between cardiovascular service lines to provide a single point of access for patient data, waveforms, image analysis, and physician structured reporting. This is a powerful advantage, in particular for cardiologists, who often, while caring for their patients, have to access multiple systems, which we sometimes refer to as swivel chair interoperability. Although capturing structured data is desired and useful, early structured reporting systems were very click-intensive, especially when compared to traditional dictation. This is why we built Centricity Cardio Enterprise. We see structured reporting for cardiology as supporting the entire care team. Cardiology is a team sport with multiple stakeholders who are able to capture and contribute data to a structured report in order to create the narrative of an episode of care, It is not the sole responsibility of the physician. It's a group effort or a team sport. Best practice workflows enable much of the structured report to be created even before the physician opens it. Ultimately, we want you to have an integrated solution that delivers you the data and enables you to make timely, informed decisions about your patient. Centricity Cardio Enterprise helps optimize how physicians spend their time, enhances your productivity by leveraging quick reports and comprehensive clinical content, provides guideline-compliant, complete documentation, and eliminates redundant documentation. Earlier this year, we introduced intelligent reporting for adult echo as part of our Centricity Cardio workflow. We're excited to launch this offering built on ASE and IAC guidelines and leveraging a rules-based artificial intelligence engine. How does it work? Well, out of the box, we have rules that generate findings from the imported values your sonographer has captured or measured at the point of care, and we automatically drive associated statements into the report. You and your hospital can create new or edit existing rules. Again, leveraging the entire care team and group effort to create this structured report. As a physician, when you open the exam, 83% of the report has already been completed. I would now like to invite Dr. Diego Segura Rodriguez to share his experiences with Centricity Cardio Enterprise and ECHO structured reporting.
So thank you, Christina, for your introduction. So first of all, I want to thank to GE for inviting me to this amazing webinar, and of course, thanks to the audience for being here. So I'd like to share with you some insights since we implemented Centricity Cardio workflow as our reporting system within our ECHO lab. But first, I'd like to mention some backgrounds of our center. So San CECILIO University Hospital is located in Granada, in the south of Spain, and it encompasses almost more than 500,000 of people health area, which means more than a half of the province of Granada. Our hospital is part of the public national health system, and last year we evaluated around 20,000 outpatient visits and more than 1,600 hospital admissions. We also performed more than 6,500 echocardiograms, more than 2,200 catheterization, and more than 700 EP studies and device implantations. So these numbers are increasing every year with a growth rate of 25% last year. Not only our growth rate has increased, but also our complexity. So herein you can see our department areas, which includes the treatment of the coronary artery disease with 24/7 primary PCI, heart failure, and inherited heart disease units. We also have a multimodality cardiac imaging unit with echo lab, cardiac MRI, and cardiac CT. Moreover, our EP laboratory performs both simple and complex ablation procedures and device implantations. We also have a cardiac rehabilitation program, and we share the adult congenital heart disease unit with our neighbor hospital, Virgen de las Nieves University Hospital. Last but not least, we have a very big focus on the education of residents and medical students. Throughout our growth process, we have found challenges, and focusing on our ECHO lab, there were some concerns to be solved. In the ECHO lab, we had an old local server based on hardware-oriented form with an independent ECHO packet workstation. We also had two different and independent reporting and imaging software with manually time-consuming work, including typing all measurements and comments into the report, as well as a lot of paperwork. So we also wanted to reduce the inter-observer variability in our echo report. And we also had some technical concern about sharing information and images with other colleagues and hospitals. Finally, another issue to be solved was an old-fashioned statistic analysis software, which was dead years with slow data mining. Facing on these challenges, we set ourselves some targets. We were looking forward to a better standardization of the echo reports, improving our time efficiency, and allowing easier data mining for statistics and research purposes. These aims are in keeping with our guidelines. Both the European Association of Cardiovascular Imaging and the American Society of Echocardiography agree on achieving standardization in the echo report, which will benefit the patient care with less mistakes and more time efficient. But what information should be included in a standardized echo report? So, supported by our guidelines, we think that an echo report should have an uniform outline and a comprehensive language, which sounds quite obvious, but all of us, we know that sometimes does not happen. Avoiding either short comments or an overly lengthy report. We have to be concise. As you know, there are certain key elements that every single report should include, such as demographic, complete name, ID number, birthday, gender, etc., as well as the technical quality of the images, the echo findings, which should include measurements and quality assessment of the cardiac chambers, valves, pericardium, and great vessels, ending up with concise summary statements. Moreover, an important point to be considered is that the software that we were looking for should include strong privacy policies with unipersonal username and password, which allow the user making a secure digital signature. This previous requirement be managed by only one software, and for us, the solution was Centricity Cardio Workflow. Likewise, it was implemented in the two main hospitals of our city, Granada, in December 2019, the San CECILIO University Hospital and the Virgen de las Nieves University Hospital. Doing it in two sites simultaneously was challenging for us, but allowed to share the entire process, correcting every incident, having a good feedback and a collaborative relationship. And a critical consideration is that both hospitals share the same cardiac surgery unit. So thanks to the CCW software, we could easily share images within the heart-in sessions with the multi-site access to Centricity Universal Viewer, meaning a quality leap for us. But previous to be installed, we have to keep in mind some consideration. A truly positive aspect of CCW is that it has several versatile options. But at the beginning, it's quite important to spend time with the company for future time saving. You have to plan your personalized configuration previous to move on, because in our experience, that was a crucial point to be considered, and thanks to do it earlier, the integration was easier for us. The implementation of new technology into a system that it's not used to might be tough at the beginning, and we have to deal with the integration of the CCW solution with the existing regional IT system, as well as PACS. So we had to coordinate it very well with the IT staff. And the second part of the transition was to using the technology. So we let the staff using the software, listening to their suggestions, and elaborating local templates according to our daily practice. Throughout the first and the two steps, it was decisive the close support of GE. It's been essential to be surrounded by such fantastic people working hard with us during the entire process, solving every single doubt that came out, and working together with the IT specialists to reach the final integration. So once it was done, we had to try it on the field. I want to show you how our workflow dynamic is, which begins with the patient inclusion into our regional IT system. And after that, the patient is automatically added to the work list of that day and is going to be available at the echo machine. So then we could perform the echo study and doing all the measurement at the machine. After the study is done, all the images and measurements saved will be automatically sent to the CCW software. And finally, we could make the final report in just few clicks, and it'll be electronically signed and sent off to our regional IT system. So after almost a year working with the CCW solution, our current benefits are that we have reached the standardization of our echo reports, thanks to predefined phrases of each anatomical structure and a high valuable tool, which is the quick report tool, which offer different predefined templates in just one click. So it's meant time saving for us in the echo lab. The CCW has also facilitated our workflow with the automatically exportation of all the measurements, no manual typing. And one of the highlights is that we reached the fully integrated system among the three systems, which help us a lot in the daily routine with the advanced echo plugin, the echo workstations, and the multi-site access to universal viewer from each cardiology area. And of course, we are also quite satisfied about the data mining system that CCW has, allowing easy statistics analysis and improving our research capability. So we all know that every project has difficulties at the beginning and previous to the CCW. We have to deal with our tendency to continue using the old one and the previous software. Another difficulty that we had that during the integration process, we have to struggle with some stones along the way, so such as the migration from the old cardiology system to the new one. And what it's meant, the handwritten data doesn't allow data mining for research purpose, nor possibility to import from previous studies. The multi-site access with the implementation is in two main hospitals and integrating with our regional IT system. For that, we have to join forces together with the IT specialists, the GE staff. They were there in every single step behind us. They made it easier, and their support was crucial in the entire process. So thanks to join forces, we could overcome all these difficulties. Ending up, there are some lessons that we got about this amazing project. So CCW has been fully implemented and integrated in the two independent hospitals of our city, but working for the same heart area, improving our workflow, which is currently being performed more automatically. Having several tailored templates has made our work quicker, and it's meant avoiding time-consuming tasks such as paperwork and focusing on the patient care and clinical decision. Reaching the standardization has reduced our reports variability, giving a better patient care and reducing unnecessary repeated tests. Finally, thanks to the CCW software, we can retrieve our statistics data easily and therefore facilitating our research activity. So that was our experience with the CCW software, and I want to thank you very much for your attention.
Thank you so much, Dr. Segura Rodriguez. We really appreciate your detail and the story of your transition and journey. to Centricity Cardio Enterprise. I would now like to invite Dr. Trachtenbreut to share his experiences from his journey with structured reporting and adoption of Centricity Cardio Enterprise.
Thank you, Christina, for letting me participate and discuss my experience with Centricity Cardio Enterprise. Prior to utilization of our new structured reporting system from GE, we used a system which had to be replaced because of security issues. That system had a lot of own issues. One of the issues was a poor acceptance of our previous system by the cardiologists, and only 16% of the reports were completed in a timely manner. Physicians also dictated the reports and had multiple templates built in the previous structured reports system. Some physicians had up to 8 different templates. We also could not see any previous reports because of the dictations. The reports did not migrate into the structured reporting area. For the patients who required serial follow-ups by cardiologists, including patients with aortic stenosis, they had to go to the original echocardiographic images to review all the measurements. Data queries, which are very important, were not possible because of dictated reports and patients who had annual follow-ups for evaluation of the severity of their valvular disease or their LV function for possible placement of AICDs were not accessible. We could not apply for an accreditation because of poor data. Echocardiography was the only structured report available, and all the other reports like stress echocardiograms, nuclear cardiology, and vascular ultrasound had to be dictated. All of this changed for the better after the arrival of Centricity Cardio Enterprise system. Now I'd like to discuss what constitutes a good report. In my opinion, Cardio Enterprise was a significant step in data integration. The ideal structured reporting system needs to combine ease of accessing the system from multiple platforms within or outside the hospital office. The images must be of particularly good quality and must be displayed on a high-quality monitors. The next important issue is an ability for the physician to complete reporting with minimal time and great accuracy. One also needs to have an ability to compare the current study to the previous images and to see previous reports and measurements. In addition to the image interpretation and report generation, an important task for me as a director of echocardiography was an ability to generate administrative reports. We had to notify our cardiologists within 24 to 48 hours after completion of the study about their delinquent reports, which would help us with accreditation with Intersocietal Accreditation Commission. The report generation also allowed us to decrease the time lag for reimbursement for multiple payers. But the most important issue was improvement in patient care. At the previous hospital system prior to my retirement, we were able to increase the on-time availability of the reports from 16%, as I mentioned previously, to over 90% after the implementation of Centricity Cardio Enterprise. The administrative functions also allows us to see the utilization patterns and times required for each specific study and would lead to improved efficiencies by switching the echocardiographic technologies into different areas of the hospital or into the outpatient imaging arena. Cardio Enterprise had allowed us not only to speed up the report generation, but also integrated intelligent reporting system, which is a part of the current release. I was involved with GE in building the logic rules for the reporting. In my experience, one of the major problems with the structured reporting was inattention of the physicians creating the reports because of fatigue and significant number of studies which had to be interpreted. The implementation of the intelligent reporting allowed us to reduce dramatically conflicting statements. For example, a physician can indicate the severity of aortic stenosis both as mild and severe, which would lead to confusion and will be incongruous with the measurements of severity. The implementation of the intelligent reporting addressed those issues. The measurement-based logic rules that have been built for almost all the chamber quantitation and other pathological conditions are available, and GE can provide you the rules for your examination. The measurements of the chambers as well as hemodynamics can be adjusted by the interpreting cardiologist, and the new findings will generate the appropriate statement. This is a very dynamic feature of the reports. The other superbly dynamic feature of the system allows each institution to alter the rules of the intelligent reporting based on the local, clinical, or research needs, and to accommodate innovations in echocardiography and new guidelines from the American Society of Echocardiography. Cardiology Centricity Cardio Enterprise also allows advanced analysis either online or offline. For example, for me, as a cardio-oncologist, it is very important and very impressive how rapidly GLS or global longitudinal strain can be calculated, and I can adjust the borders if needed to improve the measurements. CCW also allows a physician to review all the cardiac studies of the particular patient on a single platform, even if the studies were performed in different hospitals of the particular hospital chain, or even in the offices of the particular physicians who utilize GE system. Centricity Cardio Enterprise also has a built-in display to allow temporal measurements of any anatomic feature. This tool is extremely valuable for following progression of the valvular disease or seeing changes in left ventricular function or global longitudinal strain, which could alter the future treatment for the oncology patients. In the last part of my talk, I would like to highlight some observations from my experience of integration of cardiocentricity enterprise in my previous institutions. As you can see from this slide, the most important issue is the ability to identify a physician or a group of physician leaders in implementation of the new structured reporting system. Administrators or echotechnologists will not be able to do it. Involvement of the main cardiology groups in your local market should be started to allow meaningful changes. Setup of a change review board should be started prior to any implementations. The change review board will allow involvement, as I mentioned previously, of different cardiology groups to build the best possible report. Individual changes should be discouraged to minimize variability. Development of the playbook for success, as I call it, is essential for the cardiologist. In the book that I created for our cardiologists, which were about 150 cardiologists in the city, we had all the phone numbers for support if there are any problems with access to the system or to guide them through the report generation. These numbers should be well-staffed and should accommodate physician schedule in the beginning of the implementation of your project. Working with your vendor to understand how system works, including limitations, options to simplify different workflows, and to help set up the clinicians for success is a responsibility of the physician champions. We know that we can expect our peers to accept and what they will not. I suggest utilizing the quick reports, which is a normal reporting for all the modalities that are used in your institution. Combination of the quick reports and intelligent reporting will allow your physicians to be successful with minimal errors with rapid interpretation. We also provided all the specifications for the hardware that physicians might wish to purchase to be able to view and interpret studies in other locations or at home. Important IT numbers should be provided for health and security. So, in conclusion, the CVIT solutions that I mentioned previously and areas for success has been achieved through our implementation of GE Centricity Cardio Enterprise. It fulfills all the criteria that I mentioned, including ability of easy interpretation, easy access, portability, and significant time savings for interpreting cardiologists. Thank you very much.
Thank you, Dr. Trachtenbreuer. What a wonderful perspective that you were able to bring to this important discussion on intelligent reporting and efficiency. So thank you again. Let's take a few minutes to now see a demonstration of this solution in action, and I'll transition over to Jess Brenzel from our demo team.
Now let's take this opportunity to review what our physicians have been discussing regarding structured and intelligent reporting within our GE solution. As I navigate to a work list and select a patient, you will see on one monitor Centricity Cardio Workflow being displayed alongside Universal Viewer. As mentioned prior, Universal Viewer allows the clinician to be able to review, manipulate, or do any post measurements that may be needed as they review this echo exam. The key to the workflow is, as they complete their analysis, they are able to export those measurements directly over to CCW to complete the physician report. As the provider moves their attention to a physician report, you will see that CCW utilizes side-by-side reporting, with the physician report being displayed on one side of the monitor and different database fields displayed in the center. As we review the physician report, you will note that there are already statements placed in the physician report. This is utilizing our intelligent reporting. As discussed prior, intelligent reporting utilizes rules based on ASC standards and measurements obtained either by the ultrasound modality or by the workstation of Universal Viewer. If I navigate to the Echo tab, you will see that there are certain statements that have been grayed out behind them. That does signify to the user that a rule has been applied to that particular statement. If we use the LV size as an example, when we come down to the measurement, you will see that based on the measurement, it is stated that the LV is moderately abnormal. And the corresponding statement is then displayed within the physician report and database. This is key to understanding the importance of intelligent reporting. Not only does it help the provider complete their physician report in an efficient manner, but it also ensures that there is not conflicting information on the echo reports. The provider can now utilize quick reports to complete the remaining statements within the echo report. As a reminder, quick reports are templates that the users can customize that with one simple click, multiple statements can be added to the echo report. If at any time the provider would like to edit any one of these statements, they can simply click on this statement and it will move them to the exact location within the database to make that edit. Also keep in mind, upon any time during the review process, they can also overwrite any statement that has been driven to the report based on a rule. They can simply click and overwrite this statement and utilize their clinical judgment to change any statement on the echo report. As we complete our final review of the echo report, you'll also notice that there are certain statements that have automatically been drawn to the conclusion area. This can be configured to bring up statements either normal or abnormal automatically to the conclusion area. This is just one more way for us to efficiently help the provider complete the echo report. We can then sign this report electronically, and upon the signature, it can be routed out to the EMR or faxed or emailed to any outside providers. I hope this gives you a quick snapshot of Centricity Cardio Enterprise with Intelligent Reporting, designed to help physicians save time and complete reports efficiently. Thank you.
Thank you so much, Jess, for a brief demo. Certainly there's a lot to intelligent reporting. So I would ask anybody who's interested to please reach out, and we're happy to schedule a much deeper demonstration for everybody. I'd now like to turn it over back to Dave to moderate our Q&A session with our speakers.
Yeah, thank you very much for the presentation, everyone. Taking a look at some of the questions that come in. The first one that came up is, what do you find most useful with the CCW reporting system?
What the most useful feature is taking care of our patients, because now we have a live system available anytime, day or night, no matter where patient appears, and we're able to see their reports as well as their images in a sequential temporal fashion, which also allows us to see their cardiac catheterization reports, their nuclear reports. It just provides an incredible jump in quality of our care anywhere in the medical environment, in the hospital, in the office, or in any outpatient area.
The next question that had come in is, during your presentation, you mentioned some difficulties along the implementation. What was the greatest one for you?
And let's keep going with Dr. Trachtenbreuer, Dave. I'd ask him to chime in. He was very involved with our implementation. Dr. Trachtenbreuer, would you share what was one of the most significant challenges that you encountered?
Everybody needs to feel that their ideas are implemented. The second most important challenge was inadequate time that the physicians, particularly cardiologists, would spend on learning the system, and they would blame the system for problems which could be easily resolved if their attention was paid to the system, because cardiologists are so busy. And as I mentioned, the implementation and training has to be thought out into multiple minute details to make sure that we can educate the cardiologists. I had to spend many hours doing one-on-one training with the cardiologists, and that I think was the most helpful thing, to show them how useful and how easy it is to do that.
Another question that had come in is, do you think that cath lab reporting should be implemented at the same time?
As as we started working on my previous institution before retirement on a cath module, I found that the cath module was the most incredible thing that I've ever seen, because it combined everything that's needed to be done and reported, not only in lesion evaluation, not only in PCI. It has a special module where everything can be reported directly to NCDR. And if somebody who doesn't know, it's a national cath registration, which validates your success or failure. And it starts from the patient arriving to the cath lab until he or she discharged. And if everybody follows the rules, which GE has built in a very simple manner, we could achieve incredible savings, but not utilizing a third party who enter all the data, because since I was involved in NCDR, a lot of this data was incorrect and negatively affected our real numbers. And I would buy it if I could myself today, because it was really an easy module to implement.
Another question that had come in is the attendee says, we have a BioSound MyLab 30 Gold Echo system or Echo machines. Would these be able to be compatible with the Cardio Enterprise?
I don't know that.
Dr. Trachtenbreit, that's okay. This is Christina. I'll field that question, Dave. Centricity Cardio Workflow is compatible with devices that support DICOM SR. We have a mapping guide that we use to review with folks as part of our discovery process to go through those details. So we'll connect with the person who asked that question in parallel. But at the end of the day, we're compatible with devices that support DICOM SR.
May I add something, if it's okay?
Sure.
I just wanted to add that Centricity Cardio Enterprise, it includes every segment of invasive and non-invasive cardiology, and there are very few systems which allow you to do that. I'm sorry we didn't utilize every single available module at the place where I was, but we were able to use most of them. And my suggestion to whoever interested is to make sure that you build the quick reports for all of your tests. This will help everybody tremendously. And please have a group of physicians who are interested in that, because the technologists and administrators will never be able to do it. Doctors are very egomaniacal and don't listen to anybody. Please take this into account and you'll be very successful. Thank you.
So another question that came in from the audience is, can voice dictation software be used with the CCW software?
Yeah, I'll take that one, Dr. Trachtenbreit. For sure, voice dictation can be used to add details that might be needed in addition to any of the standard drop-down selections. So yes.
Another question that had come in is, what are some of the cardiologists' concern about moving to a single combined system using standard templates across all the care areas?
Well, I can address that. One of the issues was that every cardiologist wanted to have their own template. Some of them had up to 8 templates. And as I mentioned in my presentation, before you start, you need to create a change review board, which will involve all the major players from the other groups, as well as your IT person, director of the cath lab, and your lead technologist. And every change request was submitted by email, and we voted on it. Some of them were very minute, It didn't cause any problems, and we were able to do it. Some people wanted to have complete change, which we represented the board, and we told them we cannot do that. But after a while, I would say in my previous institution, only one cardiologist out of 150 did not accept those changes, which I think are pretty reasonable odds.
Another question that rolled in is intelligent reporting helping you?
One of the biggest problems that I had in the beginning with a Centricity cardio enterprise, that the doctors did not take enough time to interpret the study. And as I mentioned, you could have incongruous reports where aortic stenosis was called mild and severe. And GE was so nice for letting us work with them to create an intelligent reporting so we will not have those two values reported automatically. And that was the greatest change since I was at my previous institution. It also allowed us, with the increasing of in intelligent reporting, to directly populate the severity of all the chambers, all the valves, as well as current work is proceeding on the prosthetic valves, either the mechanical valves or the valves which are put by percutaneous route. And one thing I just want to add, if you don't mind, that GE built information system directly into your report for the physicians who cannot remember what is the normal gradient across the certain prosthetic valve, and based on the size of the valve. And that allows a cardiologist to look at that. And it also has a wonderful diastology system built in to provide information based on American Society of Echo interpretation of severity of diastolic dysfunction.
And another question had come in, what are the benefits of structured reporting beyond intelligent reporting?
Number one benefit, that the reports are uniform. So you cannot jump from one thing to the other. The second one, when you look at the report and the measurements, they're all in the same place. So it's a very rapid way to look at this. Number three, and GE has that the physicians have to fill out all the statements necessary for accreditation with the national agencies. If it's missing, then an error message will appear to allow the physician to finish that report. And that's what, and also presence of the legacy report, which allows you to see the progression of valvular heart disease, congestive heart failure, as well as LV systolic function, which tremendously increased ability for the interventional cardiologist to proceed with percutaneous valvular surgery, as well as placement of the AICDs based on the LV systolic function, and also allows us to see the progression. It wasn't shown, but the system has ability to see for each measurement the progression of the heart disease based on any given measurement parameters, like LV systolic function, aortic valve area, or gradient. That was one of the best things that I found in GE system for me as a cardio-oncologist and a cardiologist.
I think, Dr. Trachtenbreit, just to expand on that in terms of what some of our other customers have also shared with us, for sure, you're right, of standard reports and the completeness of those reports, the ability to trend key measurements or key parameters. We also know that reducing the swivel chair interoperability of having to log into lots of different systems is another key takeaway from structured reporting. Having that data available to mine from a data mining perspective, from a wing-to-wing perspective, capturing charges and usage of key inventory items. So really having a comprehensive and integrated solution. I did want to try one last time with Dr. Segura if you've been able to rejoin us. I know that you've been struggling with some audio issues.
Can you hear me right now?
Loud and clear. Perfect.
Oh, thanks. That's good. Okay.
Dr. Segura, maybe just I know that I did want to give you a chance to discuss what was the biggest challenge for you and your team with the implementation of CCW?
Mm-hmm. As I mentioned before, during the implementation of every project, there are some challenges. Our biggest obstacle for our team was the integration among 3 different software. So as I mentioned before, previous to be installed, a crucial point was planning our personal configuration according to our reality. And for that, the IT specialists and G staff had to work together on compatibility and customization for our regional IT system. So for us, it was mandatory to keep in mind and check it out this previous consideration and customize very well the CCW to the local system.
Mm-hmm. Great. And both you, Dr. Segura Rodriguez, as well as Dr. Trachtenbreit, mentioned how important a team approach is to deploying CCW or structured reporting into your institution. Maybe just a few words from your side of the key way or the key method that you were able to bring together a team to tackle this project.
So if I answer, our experience has been quite satisfying with the solution. So we have improved our logistic capability, and thanks to the multi-site access to G Universal Viewer, we can easily share images between our colleagues, between different hospitals and clinics. Basing upon our experience, we highly recommend this solution for all of those who have need to change old-fashioned software, which need updating, or being more efficient in the eco reporting, avoiding mistakes and reaching the standardization.
Great.
There's another question that had come in, which, with any IT system that you implement in the hospital, there's always kind of a learning curve. So the question is, how much time did you spend on learning how to use the system?
So in our experience, the learning process didn't take too much time. In fact, we had 2 sessions. Firstly, our team spent 2 hours of training the staff about how to use the solution as a reporting tool, and another session about administrator tools. So, moreover, during 1 week, we could perform the eco studies with the CCW software, and we were aided by the G staff so that they could solve any doubts that came out during eco reporting. So the learning process was pretty short in our experience.
Another question that had come in was, what is the length of the install for the whole platform? Or does it depend on the hospital and what they're implementing?
Dave, I'll take this question because again, it is very much related to each project. We heard the speakers talk about how many modules or modes are going live. We also know that how many physicians have to be trained, how many different workflows might be involved, the number of organizations that have to be deployed or trained to. So it's really on a case-by-case basis. I would say it can go short in terms of weeks, or clearly much longer in terms of months.
And lastly, as we approach the top of the hour here, for the physicians, what would you recommend the CCW solution to other colleagues that are looking at implementing a new CVIS reporting system?
I would particularly, my only suggestion is to go with all the modules of the CCW rather than with a single one. First, I would do all the non-invasive modules and then do cardiac catheterization, because that requires a little bit more work. Different cardiologists have to be involved in that. And because of the very many procedures done by interventionalists, as well the cardiologists who perform valvular heart disease surgery, and as well as cardiologists who perform biopsies and transplant cardiologists, that will take longer. But you should be ready to adopt everything, because it will all come together, because you cannot separate TEE from the interventional heart disease, particularly for placement of all the devices.
Well, I appreciate the input from all of you. That's all the time that we're going to have today for questions. Again, any questions we did not address today will be answered offline. On behalf of DEIC Magazine and our sponsor, GE Healthcare, we would like to thank everybody for their participation today. So long, everybody.
Thank you.
Thank you very much.
Bye-bye.